Good morning, everybody. Welcome, and thank you for joining our joint news conference today to talk about our COVID-19 preparedness with our civic and health care partners here in the Fargo, West Fargo, and Moorhead area. My name is Charlie Johnson. I am the President and CEO of the Fargo, Moorhead, and West Fargo Convention and Visitors Bureau, and I am pleased to have been asked to be today's moderator. Our objective today is to enlist our media partners in helping us provide timely, accurate, and important information to all of our communities. We appreciate all of you being here today. Let me introduce who our speakers are first before we begin. With us here at the Fargo Commissioners Room, the Commission Chambers at Fargo City Hall, are West Fargo Commission President and Mayor Bernie Dardis, Moorhead Mayor Jonathan Judd, and Fargo Mayor Dr. Tim Mahoney. In addition, we have Cass County Commission Chair Chad Peterson here with us. Joining us from Public Health, we have Desi Fleming, Director of Fargo Cass Public Health, and also Brenton Nessemeyer, who is epidemiologist for the North Dakota Department of Health. Joining us from Essentia at their location are Al Hurley, CEO of Essentia Health West, and Dr. Rich Vetter, Chief Medical Officer and Interim President. Joining us from the Sanford Fargo location are President and CEO Brian Nermo, Vice President of Operations Brittany Montecuelo, and Chief Medical Officer Dr. Doug Griffin. To ensure that we can cover all the information needed, I'll be leading us through a number of topics. The overarching theme today is that our community is coming together to prepare and respond to the COVID-19 epidemic. We all have every confidence that our area is prepared and is working collaboratively to keep our communities safe. So let's begin with the first topic. And the first topic is, of course, preparedness. We're going to hear from our mayors, first of all, what our municipalities are doing to prepare. I'm going to introduce one of them first, and they'll introduce each other before I come back and join you. So we're going to start with West Fargo Mayor Bernie Dardis. Bernie?
Good morning, and thank you, Charlie. Our communities have come together many times over the years. Whether it's floods, blizzards, tornadoes, we have a history of preparedness, widespread collaboration, community passion, and ultimately overcoming whatever is put in front of us. With the COVID-19 challenges, all of us, our communities, have experienced working through difficult times, which means we are prepared to handle it. And that's why we are here today, to share with everyone in the West Fargo, Moorhead, and Cass County area that we are prepared. Now I'd like to introduce City of Moorhead Mayor Jonathan Judd.
Thank you, Mayor Bernie, and also thank you, Charlie, for being here this morning. I do want the folks to know over in Moorhead that currently there is a command team in place to address the COVID-19 impacts and following a national incident command structure and in keeping with the framework that our city typically uses for floods. The command team is communicating constantly and making united decisions as conditions change. What is also equally as important is that we all stand together in a multi-jurisdictional effort to combat COVID-19. Primarily, we want to be rest assured to the public that we are united in our response throughout the region. We do have experts that are here that will discuss what the impacts will be, and as well as how we are going to overcome these challenges. But again, the thing that we want the public to know, we will overcome this. We will be together and united. And with that, I will pass it over to Cass County Commissioner Chad Peterson.
Mayor Judd, thank you. Mr. Johnson, mayors, thank you for allowing us here.
Hope you had a...
I am good. I think I should be. Thank you. Again, thank you for allowing us to speak. As the prior folks have said, it's important to remember that we are a team. We are operating together in unity. That's why we're here. But we've also been communicating behind the scenes as well, not just in front of the cameras. We will maintain all critical operations. Within the county, we have certain departments that cannot and will not shut down. Law enforcement, our jail, things like that will always maintain operations in a safe, conducive manner to the public at large. This isn't a flood. This isn't a blizzard. But we, as a team, are built for this. Like Mayor Judd said, we also have a command center being established at the county. The same leaders that have taken us through blizzards, the same leaders that have taken us through floods, will take us through this. We show no indication that there's a catastrophe happening. It's preparedness, not panic. That, to me, is the message that's more important than anything from this day. Preparedness, not panic. We will be there to take care of you and update you as things progress. With that, Mayor Mahoney.
Good morning, and thank you. This is an important thing for the public to work together on. We want to take on the virus in full force. Rather than waiting and delaying till something else will happen, we do have a case in Cass County, so the disease has hit our community. What we want people to understand, this is actually opposite of flood fights, is we want you to stay in home, almost like a blizzard fight, is we want you to hunker down and stay home and minimize social interaction with people. We only have 10 people in this room. We'll have minimizing any kind of meetings, and any meetings that do not need to be held will be canceled. We want people to remember, think of the ways you can do your essential work and essential type things you need done with a minimal amount of interaction with the public. So we're going to follow the CDC guidelines, and we'll have our health partners explain to many of the public what we need to do going forward. But it is critical for the communities to take this seriously. If we take it at this point seriously, we can flatten the curve on the virus, and that will be the best thing to keep it from spreading. As always, when we get into a crisis, we want people to prepare but not panic. I asked my good friend, Dr. Andy McLean, to talk to us a little bit about what some of you are feeling in anxiety, and then we'll turn it back to Charlie Johnson. Andy?
Thanks, Mr. Mayor. I have a shirt-tail relative who used to like the phrase, I've got one nerve left and you're standing on it. And I think what we've been experiencing is we've seen a lot of stress, and I think it's really important to acknowledge that. We see it in our family members, our coworkers, and ourselves, and we just need to cut ourselves some slack, cut each other some slack, recognize that these stresses happen, and there are lots of opportunities out there in terms of just learning to be mindful. And I'll mention a couple at the end. Some of the things that we can do just to make sure that we don't have this global sense of anxiety is to schedule things at home. There are lots of things that we intended to do, wanted to do. Making a list, checking them off, doing something positive is actually a very important thing, and feeling we have some control. There are lots of opportunities out there in terms of being with your family. I think Ben Franklin used to say, after 3 days, fish and relatives start to stink. The issue is there are different ways in which we can interact with family. We can read, we can put down our phones and actually interact with each other, which is a new thing. This generation really doesn't know how to do that. So there are opportunities here. Perspective was mentioned. I think it's really important to know we've been through a lot together. We know what the history has been. The present is moving very fast. The future we're not so sure about, but we're confident. And there are things that we can do to change the future, like the mayor was saying. The social distancing, or as I like to say, physical distancing. Social connectedness is a part of resilience. It's a part of staying well. And so we need to figure out how to maintain that social connection while at the same time maintaining physical distance. The fact that we're here, we come from hardy stock, you know, and our ancestors, we need to make them proud. My wife is a master gardener, and we watched the Victory Garden. And I'm sad that the younger generations don't know the history of the public sacrificing, stepping up, and actually doing things for the well-being of the country. That's what we're doing with the social distancing. As the mayor said, we're flattening the curve. We're trying to reduce the impact. In the flood years, we had a group called Red River Resilience. We still have that website up with some ideas and ways of dealing with stress. CDC has a website with dealing with stress. So there are lots of resources out there. And like I mentioned, try to gain as much control as you can at home and cut yourselves and each other some slack.
Okay, thank you, Dr. Andy. We appreciate those words, calming words in difficult times. We'd like to hear from our health system representatives now with the North Dakota Department of Health and Fargo Cass Public Health. We want to know what the status is of the disease in our area. We all know there's at least one case in Cass County, and we want to know what prevention tactics we can use to reduce the spread of the disease. So I would like to ask you guys to speak to that. I think we're going to start with Brenton from the State Health Department. Brenton?
Yes, thank you. First, I just want to update everyone on the numbers. I just pulled these numbers this morning so that the current, most updated. We've tested 274 persons in North Dakota, and 6 were positive. 1 in Cass County, 2 in Ward County, 2 in Burley County, and 1 in Morton County. 5 out of the 6 were travel associated, so that means that they were exposed most likely outside of North Dakota, whether it was travel internationally or to an area that is seeing widespread transmission. The 6th case is our first case of community spread transmission, and that was just confirmed this morning. So we do know that it's actively circulating within the community with that first community case being identified. We expect more testing as supplies become available and as the CDC is able to produce those supplies, but we're kind of waiting until we can get more of those supplies, and we are getting them in time. And then, like I said, when we do get these investigations, when we do get a positive, we do a thorough contact investigation. We do talk to these people. We do the proper notification on our channels. We're notifying those close contacts and letting them know of what now, where do we go from here, and what the best process is. Do you need to socially isolate? Do you need to stay home for 14 days? That is part of my job as an epidemiologist and my team back in Bismarck and across the state. And it's important to let everyone know that it does get done very timely. Thank you.
Good morning. So one of the ways that we can slow the spread of this virus that we've talked many times before is about exercising personal responsibility. With the new White House Coronavirus Task Force, they have announced recommended social distancing for the next 2 weeks. So we're being asked to avoid those gatherings of more than 10 people. And when we're in our smaller groups of less than 10 people, we need to be having that social distance of 6 feet or more. Also, we're asking people to avoid discretionary travel, any social visits, and really basically any unnecessary outings is what we're asking people to do. Also note that these restrictions may vary state to state, as some states are taking more restrictions as they are having more widespread community spread of the virus. So that's kind of how that's determined. Other preventative practices that we can do every day and every cold and flu season are those things we're also hearing a lot about that would help diminish the spread of viruses. Those include the good hand washing, so make sure you're washing your hands for 20 seconds at a minimum. If you can't get somewhere where there's soap and water, try use that hand sanitizer that has that 60% alcohol content. Cover your cough and sneezes. If you don't have a tissue, use your sleeve. Stay home when you're sick. This is very, very important, and we're not very good at it in North Dakota. So try stay home and stay away from people. Try avoid people that look sick. Just kind of keep your distance when you can from the majority. And then that regular cleaning and disinfecting of those frequently touched surfaces that are in your house, in your workplace, different things like that. CDC is still recommending that well people do not need to use masks, face masks. Those surgical masks would be reserved for people who might be having symptoms of illness. They may be asked to put those on temporarily to stop that droplet spread. The N95 or respirator masks, those are reserved for our healthcare providers and our first responders, and they are the ones that are caring for people that are sick. So we need to keep that supply for them. Also, please note that those N95 masks need to be properly fit tested before they can be effective. So we're making sure that the size and the seal is correct. That's all I have. Thanks.
I went away to turn off a couple mics that weren't in use. I wanted to avoid any echo we had. Thank you very much, Desi and Brenton. We'll probably come back to you as questions develop here with the mayors a little later. Now we'd like to go to our healthcare systems and find out what precautions they're taking to keep patients and visitors safe. I believe we're going to start with Al Hurley. Some opening comments from Al Hurley over at Essentia. Al?
Yeah, good morning, and thank you. From a healthcare system, one of the advantages to us locally here in the community is to be gathering information from multiple states, including Wisconsin, Minnesota, and North Dakota, South Dakota, to combine this information and come up with the best opportunity for our local communities. We are, as everyone has already stated today, following all of our internal protocols and policies relative to social distancing and following CDC guidelines, and evaluating on a daily basis the staff, process, and resources necessary. I think the two key takeaways from our health system to the community here that we serve is that we are communicating, coordinating with the health systems for the federal, state, and local agencies so that we can commit a consistency in on how we evaluate and deliver care to our communities we serve. And the second thing is just to be open to the new information that is coming to us daily and sometimes on an hourly basis. We need to be nimble to change with the new data as it comes along. Dr. Vetter, any other comments?
Yeah, I think just a reminder that, as Al said, conditions are changing rapidly day by day. We're meeting regularly. We've implemented our incident command, as others have as well. We're monitoring our supplies, our people, our facility needs on a real-time basis. We've moved to restricting visitors at our facility. We put screening processes in place at all of our facilities. We've also reached out and are working to enhance our telecare capabilities, expanding our e-visit platform, as well as going to be implementing virtual visits for patients to do from home. We're also suspending, as of today, any elective surgeries and routine health visits. We've developed a hotline that people can access us. Again, as was mentioned earlier, we want to keep sick people at home if that's the best place for them to be. And so on our website, we have a hotline that people can call in and get directions for where to receive care.
Okay, thank you. Thank you for those comments. We may have covered some of this already, but I want to hear some more from the healthcare systems about specific precautions for patients and visitors. We'll probably start again with Al. Is there anything that you'd like to add that you haven't mentioned already?
It's important that as patients or our community members have any questions or concerns or should I be tested, the important thing is to call ahead. On our website and our toll-free number, you can get advice. What is the next step I should do for myself or my family or someone who they may have a concern or question about. Relative to coming into our visiting our clinics or hospital facilities, we are advising to limit visitors that come in with them, and we will be screening those visitors as they come in just to create the safety for themselves, the patients, and our staff. I'd add those two things.
Okay, we'd like to perhaps on the Sanford connection bring in Brittany on this too. Do you have anything you'd like to add about precautions being taken, Brittany?
Thanks, Charlie. I'm going to hand it over to Brian just for some opening comments, and then I'll get into the specifics about some of our precautions.
Thanks, Brittany. Good morning, everyone. This is Brian Nirmo, the President Chief Executive Officer for Sanford and Fargo. I think the most important thing for the region's residents to know is that the community is prepared. Sanford Health started our journey 6 years ago in collaboration with the state of North Dakota after being designated the state's primary Ebola treatment unit. And since that time, we've engaged in accelerated planning, heightened training, and overall preparedness for future pandemics. Every single day, we have over 100 people from Sanford at each of our locations around the tri-state area talking and coordinating not only within Sanford, but with our other healthcare partners like Essentia, with our local communities, and our state Department of Health and our governor's offices. Since the early stages of this current pandemic, we've been utilizing a capacity model from the University of Minnesota and the Minnesota Department of Health. And Dr. Doug Griffin, our Chief Medical Officer, will provide more details regarding this model. But I want to emphasize, based on the information we have today, our modeling indicates that we have the asset capacity to treat patients under several different scenarios. And I think that's really important to emphasize. I'd like to now turn things over to Dr. Griffin, our Chief Medical Officer, to provide more education on COVID-19, why social distancing and other measures that are being suggested for this pandemic is important, and more details on our preparedness. Dr. Griffin.
Yeah, thanks, Brian. So the reason the world is handling COVID-19 much differently than influenza is because we don't know as much about this virus as we do the flu virus. And this is why we're seeing different steps taken across the country and across this world. Here is what we think we know about COVID-19, and our knowledge is expanding every day. If we had the same number of people that contracted COVID-19 as the influenza, we would have 30 to 40 more deaths than there are to influenza. And this flu season, we've had nearly 22,000 deaths in this country. So that is why we need to take this very seriously. With that said, people that contract COVID-19, 80% of them will recover with remedies that they can do at home. About 15% will require some sort of hospital care for recovery, and 5% will require critical or intensive care needs. In a model based on knowledge from the University of Minnesota and the Minnesota Department of Health, and looking back on outbreaks in China, we could project for a population base of 500,000, a little smaller than the state of North Dakota, that our best case scenario would be 6 cases develop over a 2-month period. It's clear as of today, we will easily exceed that since we're at 6 cases. More of a medium case scenario would be 550 cases or so, and worst case scenario would be 3,600 cases. But the bottom line is that if we all follow the CDC's guidelines, we can flatten that curve and make an impact in reducing these numbers and keeping them small. I'm going to turn it over to Brittany Monticello for her comment.
Thanks, Doug. So much like Essentia, we have implemented new visitor policies to protect our patients, our employees, and our other visitors from the potential spread of COVID. Our visitor restriction policy allows one immediate family member to visit at one time. We really ask for the public's understanding this is a safety precaution that's absolutely necessary to ensure that we curb the spread and flatten the peak to Mayor Mahoney's point earlier. This is consistent with what the CDC is recommending. In addition, we are going to have access points that are very limited to our hospitals. So we ask that you come through the ER entrance or the front door. Those will be the only 2 points, and you will be screened. So all patients and all visitors in the ambulatory, so clinic setting, outpatient or inpatient, are going to be screened prior to being seen at any Sanford facility. That's every patient, every visit. If you're coming in for a regular preventative health screening, or you're coming in because you're not feeling well, you will be screened. An important note about screening is that the guidelines are very fluid. So we are staying closely connected with the CDC recommendations, our Department of Health, as well as public health, to make sure that we are utilizing the appropriate guidelines as they change and adjust. If you are experiencing symptoms and you're concerned that you may have COVID-19, we ask that your first phone call is to your primary care provider or to My Sanford Nurse, which can be, you can contact at 701-234-5000. So again, 701-234-5000, that's the My Sanford Nurse. They're able to do a screening over the phone, and they will connect you with a screening testing location if your screen is positive. We do have drive-through testing sites that are up and available, both in the metro as well as some key locations out in our network. The best thing to do is call your primary care provider or My Sanford Nurse, and we will get you screened and we will get you into the right location.
Okay.
Charlie?
Sorry, go ahead. Is that all for you, Brittany?
Charlie.
Okay, so we do want to talk a little bit more about testing. You've already touched on that, because there are a lot of questions about testing, both nationally and locally, and Brittany, I know you started to talk about that. First of all, Dr. Griffin, let's go over one more time. Who do healthcare professionals believe needs to be tested?
Yeah, as Brittany explained, the patients first must be screened to see if they need to be tested. So the screening involves questions regarding travel, exposure, and very importantly, the symptoms, patients having symptoms of that fever, dry cough, or shortness of breath. As Brittany mentioned, the screening is changing and evolving, so I recommend referring to the CDC for the latest guidelines on who should be tested.
Okay, I have one question. I think I'm going a little bit off script here, but some people who have fevers, only a fever, that wouldn't necessarily mean you would test them, correct?
Yeah, that is correct, Charlie. We would also want to know about travel and potential exposures.
Okay. Does anyone else in either office want to add to that about the testing?
This is Dr. Rich Vedder over at Essentia Health.
Yes.
I just want to remind people that we do have other viruses circulating in our communities at this time. You know, influenza, RSV, other viral illnesses out there. So just because you have symptoms doesn't necessarily mean that you have COVID-19. In fact, the likelihood that you have COVID-19 without some of those screening questions, as Dr. Griffith just reviewed, is extremely low. That the most likely is that you have some other viral illness that's in our community at this time of the year.
Okay, thank you. So we want to, Brittany already touched on this, there are going to be some drive-through testing sites, and we kind of wonder what the turnaround time is when you do get tested, but I also think I would like you to clarify, nobody should try to go access a drive-through testing spot unless they've been screened right first, right, I should say?
Correct, Charlie. So we're asking the public, if you feel like you have had an exposure, you're not feeling well, and could potentially have COVID, call your primary care provider or call the My Sanford Nurse line. They will do a screen over the phone, and we will get you to the right location. And so we actually have appointments that we will book you into our drive-through location or dedicated sites that we will direct you to for testing.
Okay, thank you. Because I think sometimes people get confused if there's a drive-through testing spot that anyone can go to it, but you want them to be screened and directed to it. So someone else jumped in. Go ahead.
We do.
Yes, this is Al Charlie. To add to what Brittany had stated, Essentia Health also has a couple sites that are going to be setting up during the next week. And so the community members and patients call ahead, call Sanford, call us at our respective lines, and get that direction so that they're going to the right place and they get access to the community. We're working collaboratively within our community to provide resources and access to anyone that needs that. Thank you.
Okay. And I'm not sure I heard this. I may have heard this in the answer, but I'll ask it one more time. Once a person has been tested, what is the expected turnaround time on results?
Yeah, Charlie, this is Dr. Griffin. So it is, I think actually it's probably better to refer to the drive-up areas test collection site. In the test is then said now the turnaround is 3 to 5 days.
Okay. All right. Thank you. So here's another question related to testing. What if we do have an increase of patients who need to be screened and then tested, are there adequate supplies, do you feel, at your facilities to handle any kind of significant increase?
Yes, we have adequate supplies. We continue to monitor those very closely, but currently we have adequate supplies to make the collections and get the test done. Okay, thank you very much.
Yeah, I would say the same at Essentia Health. We have enough supplies to do the swabs. We're getting our testing done through the state lab right now until commercial testing is more readily available.
Okay. Brenton, would you like to add anything to that about the availability of testing? You represent the state health department. It's basically they're telling us accurate information, correct?
Yes, as far as I know, their supplies, they have supplies, so they're giving the most accurate information.
Okay. The important thing is get screened first, then you'll be directed to a test. So this is all very helpful information. Of course, there are a lot of rumors out there. Information changes constantly. So I think it would be helpful if we were able to tell everyone what the best sources of truth are. Where should the public go for accurate information? Could each of you, among our medical partners, and I would include the state health and Cass County Public Health in that. In fact, let's start with you. Where are the best places to go to find the proper information, short of picking up the phone and calling somebody?
Sure. So this is Desi from Public Health. So in the state of North Dakota, just so everyone is aware, the North Dakota Department of Health is the lead in our pandemic response. So Fargo Cass Public Health and local public health play a supportive role in that. So we do ask that people really try to stick to credible sites when they are looking for information. So the North Dakota Department of Health website, which is ndhealth.gov. We also have a hotline that's available that is 7 a.m. to 10 p.m. that is every day of the week. That number is 1-866-207-2880. And then the other website for credible information would be the CDC website, which is cdc.gov, or you can do coronavirus.gov. Either one brings you to the CDC.
Okay, thank you. Essentia, who would like to step in and talk about what you think are the best sources for that?
Yeah, I think you want to stay, as you mentioned, with reputable locations. The CDC site is a good site. If you access our Essential Health website, essentialhealth.org, all the links are on there, and you can access those other sites readily from there. We are selective on what sites we put on there or what links we put on there, making sure that they're reputable. You could also reach out to our hotline that we've set up specifically for this. That's 1-833-494-0836, and that will direct you as well.
Okay, and at Sanford, Brian or Dr. Griffin or Brittany?
Yeah, this is Brittany. So we really want to encourage people to utilize our website, sanfordhealth.org, or we have a news site that is news.sanfordhealth.org. We're keeping the site updated and making adjustments to it as the situation remains very fluid. Additionally, our phone number that is staffed 24 hours a day, 7 days a week, and can get you a live person with answers is 701-234-5000.
Okay. Thank you very much. This has all been really helpful information. We want to thank all of our experts for joining us today, all of the mayors, Public Health, Sanford, Essentia, Dr. Andy, thank you for being with us here today. This doesn't necessarily relate to health, but I'd just like to sneak in a little plug here. There are a lot of businesses that are negatively affected right now in all of our communities. And I think anything you can do to support them while maintaining the guidelines of social distancing would be a thing to do. We all have our favorite places we like to go, and a lot of people are not going to be working for the next few weeks for various reasons. So there are ways to support. For instance, restaurants, many of them are gearing up to do takeout. You can buy gift cards, and all sorts of other retail establishments will need our support too. So think of them as we move forward on this. Thanks again, everybody, for being with us, and make sure you remember, call before you go, get screened, then they'll decide if you need to be tested, and check all of those websites that were just offered up to you for information. Thank you, gentlemen and ladies, for joining us.